Okay, I'd like to call the Monday, October 4th Justice Health Committee meeting to order. We have all members present except Member Bloomfield. We have minutes from August 30th, 2021 of our regular meeting to approve. Do I hear a motion? Motion by Martin, second by Chung. Any additions or corrections? Hearing none. All in favor? Aye. Any opposed? Okay, the motion passes. Are there any members of the public?
Chairman Schaefer, there are not.
Thank you. Under departmental matters, first up is Jason Tabb, juvenile detention.
Good afternoon.
You have your report on pages 4 to 6. Is there anything you want to comment on, or?
Yes.
Okay.
I will bring to your attention that on page 6, the August numbers are not in there. Those should all be zeros.
Okay, thank you.
Other than that,
Anybody have any questions? Thank you.
thank you.
Next is Jessica McKnight, Health Department Administrator.
Hello.
You have a report on pages 7 through 16. Is there anything that you'd like to comment on?
Nothing to add, but I'll be happy to answer any questions.
Any questions for Ms. McKnight? Okay, thank you. I'm sure we'll have questions later. Next is Nursing Home, Interim Administrator Kim Holster.
Hello.
Hi. You have 2 items for action. First one is the request approval of nursing facility hospice respite care services agreement with Compassus, NWIL, whatever that means. Do I have a motion? Motion by Johnson, second by Metzger. Do you want to say anything about that?
Sure. Both the Compassus and the Transitions are hospice companies that serve the area. With opening Serenity Lane, we think it would be beneficial to add in additional hospice companies.
Okay, anybody have any questions? Member Johnston.
Thank you. I just had a quick question. I'm not sure if I should ask it on this one or the next one, but I noticed really the biggest difference was that it was a 2-year versus a 1-year. Could you speak to why they had different lengths, or?
I think as far as legal, we're trying to make it so that way we have a stop date instead of just the yearly renewal where it automatically renewals. So that way we're actually looking at the contracts and making sure we're updating things as needed.
So is this just a request from the companies for one for a 2-year, one for 1 year? And
Yes.
Okay, thank you.
Anyone else have questions? Okay, Member Metzger.
I just have a question, and that is, how, if I have a loved one or myself that goes into hospicing, and then how do they choose? I mean, do they bring their own if they want, or you give them the list and they have to choose? How does that work?
We give them pamphlets on the different hospice companies that we do have agreements with, and we allow the family or the resident to choose which service they feel would best fit them.
Thank you.
Okay, anyone else? Okay, all in favor? Any opposed? Okay, that motion passes. The other one is request approval of a residential hospice agreement with Transitions Hospice LLC. Motion by Chung, second by Johnston. This is just another
hospice company. We currently have utilized it for a single contract, so it's just extending it to all residents in the facility.
Okay. Any questions? Hearing none, all in favor? Aye. Any opposed? And motion passes. Then you have your monthly report on pages 61 through 66. Is there anything you'd like to point out on that?
No, I just do want to add our census as of this morning is 86. So we are moving up. 15 of those are Med A recipients.
Which is good,
Yes.
which is really good. So that helps the bottom line. Any questions? Okay, thank you. Next is Suzanne Scott from Adult Detention Medical, and I do not see her.
No, Chairman Schaefer, she is on the floor at the jail currently and could not make it to the meeting. If you have any questions about her report, I'm happy to try and answer.
Anybody have any questions? Okay. Moving on, Ms. Taylor, Interim County Administrator.
Thank you, Chairman. So now we are moving into items to be presented for action with regard to our budget. And so the first one is the request approval for the budget for TORT 0135. And that is for both the Juvenile Detention Program 0022 and Risk Management Jail Correctional Health, which is Program 0073. And I would entertain a
Do a-
motion.
A motion? Motion by Martin. Second by Metzger.
Okay, we have prepared a very quick PowerPoint presentation. The first one being the Juvenile Detention Center. So this budget is comprised of the funds necessary to provide mental health services at the Juvenile Detention Center. It also funds a staff RN for sick call encounters, dental screenings, and TB testing, any other necessary medical services that are needed at the JDC. And the majority of that budget, 57%, is salaries. 38% is services, and then the last 5% is supplies. This budget primarily has remained the same since the previous year. There have been 2% reductions when requested by administration. And that's all I have for
Okay.
JDC.
I wasn't sure when you were done. Okay. Any questions regarding this budget?
Okay, next up we have jail medical. The jail medical budget, the total expenses are $1,331,421. Salaries, again, are 50% of those expenses, which are up a little bit from 2021. Services are 36% of those expenses, and supplies 14%. Of note, on page on page 73, there is a transfer that is for telepsych services. The significant increases that you'll see on page 74 are for cost of prescriptions and vaccines. That has gone up 48% from last year. And for example, Ms. Scott let me know that one inmate had a $3,000 cost per shot for an infection that he was fighting. And so the cost of those services is increasing all the time. Then if you go into services, the only... Yeah, we had one inmate. She gave an example, and she said there was one inmate that had a shot that cost $3,000 per shot. That obviously is not typical, but can be something that they are faced when they have a doctor prescribing those medicines. Where? Okay. That one? The other items of note on page 74 in your packet would be a contractual increase for the medical director fee and increased costs to non-employee medical expenses for transport to hospital visits. And if there are any other questions, I'd be happy to answer.
Are there any questions on that budget? Are we ready to vote? All in favor? Any opposed? Okay, motion passes.
The next on your agenda would be the request for approval of the Health Department. We've got this divided out and listed out in 8 different categories, and if it pleases the committee, I would go through one by one.
What I'd like to do is, go through them individually, but at the end, but not vote on them until, well, I guess this one we do want to vote on. In the past, we've done it several different ways. We've done it individually and voted on that particular fund budget, or we've waited till we've gotten through the complete budget for the health department, just voted on it all at one time. However, at the Board of Health meeting last month, when we looked at the budget to approve it, there were several things that were concerns that the Board of Health was not aware of how they were all going to fall out, particularly with respect to the ARP funds and some issues that the Board of Health wanted to make sure they addressed with COVID and funding some things. So the Board of Health has asked if we wanted to do and pass some of the budget funds today, but to not pass the 107 and the 112. And so, and some of the Board of Health questions may be addressed in the presentation, but those two they would like to revisit at the Board of Health meeting this month, just because of they did not know we did not know at the time what the ARP funding was going to be and things like that. So those were the two that were impacted by that. So I guess that before we get going that.
Well, I have a question about that item then. So then will we be approving those 2 lines at stand-up or
Well, we could do it at our November meeting.
November health? Okay.
Yeah.
Okay.
And then, yeah, those two would be approved at November Health meeting.
Okay.
Member Chung.
Thank you. Can you just repeat again which ones we would not be doing today? that the Board of
107, which is number B5, and
Okay.
B8.
And that all of those lines under 8 then, everything, oh no, just 8? Okay, sorry, you're right, I see that
8,
now.
yeah, all the ones under 8, all of 8 and 5. Is
Okay, thank you so much.
that okay with the committee? Like, is that okay with administration?
Yes.
Okay.
So I'd ask that Jessica McKnight come up to the table while I
can't
do
hear you.
my, I'd like Jessica McKnight to come up to the table while I do my PowerPoint so that she's poised to assist should there be any questions. So the purpose of the Health Department is to fulfill the public interest in assuring conditions conducive to good health and providing leadership in promoting and protecting the health of county residents. And to that end, we do have tax levies that assist us in that charge. And this slide indicates to you what the tax levy totals are for 2021 and 22 and what those rates are. As you can see, the rates for both are 0.11083 for a zero net change in 110 and 112. The total revenues for the department, sure. There is a lot in this slide. The revenues for 2022 for the entirety of the health department total $8,709,226. 53% of that comes from property tax, 31% from intergovernmental agreements, and the rest is small percentages that include licenses and fees, charges for services, contribution, and miscellaneous contributions. This is a decrease from the previous year, and we will address that shortly. Expenses to the health department are listed here. On the left-hand side, you'll see total expenses with 59% in salaries, 37% in services, and only 4% in supplies. For grants, you can see that 64% of salaries account for those grant funds, 32% services, and 4% supplies. And then if you parse out the tax funds, only 55% salary, 40% services, and 5% supplies. As noted by Ms. Schaefer, we are recognizing that the total budget for the health department was reduced significantly this year. Part of that is due to COVID grant funds that were not expended for 2022. But as you can see at the bottom of this slide, we have supplemented the health department funding by removing from their general budget and putting into our ARP budget $300,000 for a mobile clinic van, as well as $150,000 to continue contact tracing if necessary. And that is all I have for the slideshow.
Thank you. For the contact tracing, the 150,000, given where we are right now, how long can we expect that to last?
Can I ask you to
Yes.
hold off on that? Because that goes in the 107. that
Okay.
The Board of
They're
Health.
still going to be adjusting that?
Huh?
They're going to adjust that possibly?
There may be an adjustment to the budget. I guess you can answer the question, but I think that's one of the reasons the Board of Health wanted to wait, because we didn't know at the time what funds were going to be allocated. So that is that fund and why we
Right.
wanted to wait. So
I was just curious, given this allocation, how long it might last. Is that like a 1 month? Is it 5 months?
The initial request was for a reduced capacity contact tracing program for 6 months. As Ms. Shaver said, we're kind of right now, we are anticipating and expecting some additional state funds, but not sure of the amounts yet. So this is a starting point for us, and then we should know in the next week or two what that amount looks like for 2022 also.
That was my next, thank you.
And the CDC is going to throw us some curveballs in the meantime.
I have a question regarding the mobile van. That is for, what does that 300,000 include?
So that includes the cost of the vehicle and then additional licensing. So that's what we're looking at right now for purchasing a vehicle. It's about, I think, a 9 or 10 month wait. So really, we're getting the program planned, knowing that even hoping to order the vehicle in early 2022. So that 300,000 would get us the vehicle and get us started.
How will that impact salaries? Does it require a CDL?
We're looking at a couple options. So one of the options that I'm looking at is something that we have definitely needed over the last year is, a trailer and a vehicle that could tow that to a location. Several of our vaccine clinics in the rural areas have been at set spots. So that's one option that wouldn't need a CDL. And then obviously there are a few of the smaller vehicles that we've been looking at, smaller, and I say vehicles such as like an RV, a smaller RV that would not necessarily need a CDL. So we're kind of weighing several different options. The last year we've definitely needed a trailer and a vehicle to tow that. So that's kind of one avenue that I'm exploring.
We don't have a motion on the floor if we'd like to continue. We don't have a motion on the floor?
So, as I said earlier, if we'd like to go through these individually, then we can do that and skip those two, or we could discuss those, but we can not finalize them. So I guess I would need a motion for B1, Dental Sealant Grant 102, Personal Health Services Program 0062. Motion by Johnston, second by Chung. Is there any questions on this budget? Or anything Ms. McKnight would like to expound on? Question, Ms. Johnston, Member Johnston.
Just wanted to double check. The John M. Scott Estate Program, is that something that comes in right at the end of the year as far as its arrival? Like the funding on that one? It just shows that it hasn't arrived this year, the 20,000.
That I'm not sure of. And we have some money that it's a multi-year, so it may not have been expended yet.
Okay. All right, thank you.
Any other questions on 102? Hearing none, all in favor? Any opposed? Okay. Next is the WIC, Grant Fund 103, Personal Health Services Program 0062, on pages 79 through 81. Is there any, do I need a motion at first? Motion by Chung, second by Johnston. Any questions on that budget? These are all grant funded, so they're pretty straightforward for the most part, so. Hearing none? All in favor? Aye. Any opposed? Okay, that one passes. Next is B3, Preventative Health Program, Grant Fund 10105, Health Promotions Program 0067. on 82 and 83. May I have a motion for that, please? Motion by Chung, second by Beer. Any questions on that? Anything Ms. McKnight would like to say? That one. Okay. All in favor? Any opposed? Okay, and that one passes. B4 is Family Case Management Grant Fund 0106, Personal Health Services Program 0062, on pages 84 through 86 of your packet. A motion? Motion by Martin, second by Johnston. Any questions or any comments from Ms. McKnight?
Just wanted to comment and note, I believe there is a note in the workbook, but the genetics program, which was 407, I'm sorry, yeah, 407-0063, the state is restructuring that. So for at least 2022, we do not have that revenue.
Any other questions? Hearing none, all in favor? Any opposed? Okay, that one passes too. B5, the AIDS Communicable Disease Control Grant Fund 107, Environmental Health Program 0061, and Personal Health Services Program 0062. That is the one we would, the Board of Health would like to look at again, based on the information that they have, will have now. So, can I just skip it, or do I have to table it? Can I just skip it, or do I have to table it? Pass on that one? Okay. Moving on, B6 is a Federal Financial Participation Program, Grant Fund 109, Personal Health Services Program 0062 on page 91. And that is just an old revenue fund. Have a motion? Motion by Chung, second by Metzger. And that, we actually did get some money this year from them. Any questions?
Again, I don't have my glasses today, so.
Okay.
So these are not being funded? Some of
No,
these
this is revenue because it's reimbursement from the federal government on Medicaid billing, and they changed it several years ago to where they now have it in a different reimbursement method, which if you went back to 105 or 106, you would see that on the revenue where it says federal portion only and state portion only and things like that. That they changed the way they reimburse some of those programs or that billing. So that's why there's no money going really into 109 anymore.
Okay,
Correct?
thank you.
So there's really no expenses. It's just used to transfer out. Anything that's in 109 can be used, anything public health wise. So. Did we vote on that? No, okay. And the other thing too is that when you look at the CAFR, the fund balance from 109 is in the fund, it combined with the fund balance of 112. So this was an accounting method. All in favor? Any opposed? Okay. That one passes. The next one is 7 is Persons Developmental Disabilities Grant Fund 110, Mental Health Program 0060 on 92 and 93 of your packet. Motion by Johnston, second by Chung. Any questions or comments on that one? This is a 377 board, for those who are unaware of how that matches up. Okay, no questions? All in favor? Any opposed? Okay. And then on Fund 112, does anybody have any questions if they've marked anything? Or is Ms. McKnight, if you have anything you'd like to say about that? Nope. Anybody else? You have a question, Member Johnston?
I do have a couple questions. Just wanted to kind of clarify if we look down to Fund 112, Department 0061, Subdepartment 0062, there's a pretty hefty increase in the dues and memberships. I was just curious, like, what we're using those funds for, and how that's helping the health department. Because I'm in the big book, it's on 258.
What's the line item number on that one? It's
0715.0001.
yeah, it's going from $576 to $1,700.
64. I just wasn't sure if this was something new that we're adding into, or that we're kind of joining and doing dues and memberships with, or is it because we have more staff?
No, and we had been working on spreading out, reallocating amongst the 112 different dues. So that's likely, I don't have a note that and if it was over a certain percentage, we needed a note. So nothing new,
Okay.
but it would have just been reallocation, spreading the amounts from the 112s to different funds.
Okay.
Any other questions on 112? I do have a question, and I think it has to be addressed to administration on because I think the Board of Health is probably going to ask me this question. On the ARP funding for the van, how does that show up in the health department's budget?
Go ahead.
Because we had a line item that had capital assets in there. So how does that show up in the 112? Because that's in the 112.
Yeah,
It's been removed.
it will not show up in the health department budget. It shows up in the budget for Fund 163.
Okay, so I looked in this book, but I couldn't figure out where it was.
It's in the,
in-
yes, in the capitalized assets for Fund 163.
I just gotta make sure I have it noted right. Find it. All right, where is it? What page in the budget book is it?
I have it at 273 as the capitalized assets for 300,000.
Oh, I hadn't gotten to it yet. Sorry. There we go. So it's under capitalized assets,
It's
under
in-
legislation and policy, and that way?
Yes,
Okay.
and the total is, 1.2 million, and that 300,000 is part of that. I'm sorry, that's not the total.
Because here it's,
The total is 1,550,000.
right, so it's in
And
there.
that 300,000 is in there.
Okay, so then where is the 150 for the contact tracing?
That is in the same budget. Under contract services, 0706.0001. It's a 230,000 line item, and 150,000 of that is for contact tracing.
Okay, so we will not, the Board of Health would not see it expensed under the board,
No,
the Health Department budget?
no.
Okay. All right. Thank you. Make sure I have that clear for them.
So
On
what
the-
page, I'm sorry, what page is that for where it got moved to?
8,
Page 8. Okay. And does that mean it's going to come out of our health, out of the health budget back here as capitalized assets, or it gets included in that?
no,
as
that's why the capital assets in the 096 fund was 300, was originally, the department head had asked for 300,000, and then it got zeroed out
Okay,
from the administration,
yes.
and it's because of this being elsewhere in the budget. And I just wanted to make sure it was clear to me to take back to the Board of Health as to how that was being done, because they would not see, that anywhere in that budget, and then they wouldn't see the contact tracing being expensed out of 107. That's why they wanted to make sure they understood, everything before we passed the budget on them.
Thank you.
Because of the regulations with the use of the American Rescue Plan Act, it made it more simplified and straightforward for not only our purposes in accounting for those funds and expenditures, but also for our audit, to have those all listed together in one separate fund. And so that is why we removed those from all of the different requests from each individual department, including the health department, and zeroed those out in their lines and then put those into our ARP fund.
Right, that's what the Board of Health, I think, wanted that very clear. Member Metzger.
And that goes to exec?
Yes.
Okay, thank you.
Any other questions on Fund 112? Okay, Member Chung?
Yes, thank you. Gosh, I got pages upon pages. Okay, I know that under community outreach, there was a communicable disease investigator, and now that position is not there anymore.
What page are you looking at?
I am, oh gosh, well, this is in the big book on page 274, but I know that it was, it's kind of reflected on page 272, which is line 503.0001 under full-time employee salary. I guess, at least I think it is. And I'm looking in our packet here. Sorry. Working from two things. Oh, this would be under, I guess, in page 112 in our packet for today. But yeah, and then I was looking here at the sort of like, I guess the salaries and employees. And so I was just, do we have a communicable disease investigator, or is that taken on by somebody else? Or I know how the way that these things are kind of funded. So I was just wondering if it's reflected anywhere else. Thank you.
Well, we haven't decreased any FTEs for communicable disease investigators. sometimes the ways that positions are classified, it might be a different name. So we have reduced an FTE in the last year for our cause the change agents grant that is ending, and so we're not going forward with that in 2022. So that may be the position that's missing.
Anyone else? Okay. So we will see if there's any changes from the Board of Health at our November meeting for the 112.
So just that we have it on the record, number 5 for Fund 107 and number 8 for Fund 112 are going to be postponed until the November Health Committee
Correct.
meeting. Very good.
Okay, all right. Postponed, okay. I have a motion to postpone those two until our November meeting. Motion by Jung, second by Johnston. All in favor? Any opposed? Okay. Thank you. It's pretty painless today. We're back to
Okay, next up we have F1C, request approval of Nursing Home Fund 401, Nursing Home Department 0090 for fiscal year 2022. And we also have those listed out as 8 separate items. So we can begin with Nursing Services Program 0080, if it be pleasure of the committee. I do. Did you want a motion before or after?
sorry. If, on the nursing home, if we would like to make, I think, one motion for the entire nursing home instead of going through each one of those individually, I think it would be acceptable. Motion by Beer, second by Chung. Now you can have your presentation, I'm sorry.
Okay, for the nursing home budget for 2022, I'd just like to remind you of their mission. It is their philosophy to provide quality care in an atmosphere that allows both residents and their families to feel comfortable and welcomed during the resident's stay. McLean County Nursing Home has a long history of having a solid reputation in the community for providing consistent quality care for those who live with us. We intend to uphold that reputation by continuing to maintain and improve standards of excellence. The revenues for the nursing home for 2022 would be $8,883,390. I'm sorry, $8,883,393. I was thrown off a little bit there because I have a typo. The approved budget would be for 2021. You are still considering the proposed budget for 22. The sources of revenue in each of those categories, 70% is for charges for services, 9% transfers, 13% miscellaneous, and 8% intergovernmental agreement. The nursing home expenses total the same, $8,883,393. 65% of that is salaries for nursing care, as well as the other positions that make up the staff of the nursing home. 10% is supplies, 25% services, including our therapy services, and It's showing as 0%, but capital assets and projects that are still included in their budget would total $5,500. The American Rescue Plan will account for a patient transport van, nursing support services, fan coil units within the facility, the exterior brick restoration, tuck pointing, and an electrical switch replacement that was identified with the current electrical work being completed. And that is it for our PowerPoint, at least. So moving back to your packet, the nursing services program, which is 0080, begins on page 117 and 118. And either Kim Bolster, the interim nursing home administrator, or myself would answer questions.
Any questions? Okay. Next is the social services program, 0081. Are there any questions on that one? Okay. The activities program, 0082. Okay. Dietary program, 0083. Get out of here. Good time. Laundry program, 0084. Member Martin.
I just have a question about supplies. Do you do your own laundry there, or you do? Okay, so you're not having a supply issue like we're seeing across the country?
Not right now,
Okay, so these numbers would be accurate.
correct.
Domestic services program, 0085. Plant operations and maintenance program, 0086. And general administration program, 0087. Any questions on that? I have a question. The 773 line, the non-contractual services, that's the agency?
No. No. In which sub-department?
Hmm?
Which sub-department?
Were you in general administration 0087?
Yeah.
Okay.
Do you have it?
I don't have the big book that you have. I
Okay.
have these.
Thank you.
It would be on page,
We're pulling up another screen.
page 130.
131.
I start 31, the 0778 line. I mean, it's the 0773 line. Is that the agency?
I think I'm not mistaken, yes, that's correct.
Those are payments to healthcare and family services for, they're paid quarterly. And it's based on the number of licensed beds that we have. We talked about this the other day.
Yes.
Can you explain what that is?
So when you're licensed for a certain amount of beds, you have to, whether they're filled or not, you have to pay to keep them active.
Okay, thank you. Anyone else have any other questions? Hearing none, all in favor? Any opposed? Okay. Budget passes.
Administration has no other items to be presented for action, and there are no other items to be presented for information.
Thank you. Any questions for the administrator? If not, moving on to other business and communications. Want to note that our next meeting is November 1st at 4:30 instead of 3:30. I'm going to get out of here by 4:30. All right. And then our December 6th meeting time has been moved to 4 because of conflict with the city. Other things that I would like to discuss about meeting times is that I would like you to all to think about some options for next year, because next year there are 5 meetings that will have to be changed because of either a holiday or a conflict with exec. So that's almost half of our meetings. So I think that we were looking at possibly changing the date and time of the meeting. And so, Ms. Morlock, do you have that information that gave us some options?
Right now, based on what the availability in this room, there's not a lot of options because we now share it with the city. So the only ones that I have right now besides are mornings, Wednesday or Thursday mornings before anybody goes to work. Because other than that, if I pull up my calendar for this room, Mondays aren't working well. That's why you would consider changing it. We already have transportation in the morning on Tuesday, justice in the afternoon on Tuesday. Finance, we already have to have that in a different location. And then we have property and land use on Thursdays in the afternoon. You could always do it on well, I can't do it on a Friday because then I have to get out executive as well. That could be an issue. Microphone, is your mic on?
If you have work conflicts and you have childcare conflicts and things like that, that's why I don't want to, do anything today. I just want us all think about what we want to do moving forward next year, or if we want to try and figure out how to change 5 meetings. Member Martin.
I may have missed something somewhere along the line, but aren't we we're talking about combining 2 meetings, which would open up land uses time, would it not? If the board agrees to that?
No, that hasn't been decided yet.
I understand that, but if it were to be decided, that would open a time slot in the evening, would it not?
It would. But
Okay, I'm just asking.
Yeah, it would open that, but since we don't know that, and we don't know when that might happen, I don't want to keep changing. I'd like to set something for the entire year, when we make a decision. So that's why I just want you to think about it, although Wednesday mornings are not an option for me. So, Member Metzger.
So finance changed rooms on occasion. So is that not an option to use a different room?
At the same time, we can't have it at the same time as another meeting since we have to have admin.
Yeah, but the conflict is not because we have a conflict with, I mean, well, I guess the one that is exact is, that's one meeting. Are there,
Exact, because just the timing of when the
right,
calendar
but
falls.
how
Some years it
many
would work,
exact
some years
are
it
there?
won't.
How many conflicts for exact are there?
3.
Oh, there are 3.
There's
I haven't
2
looked at
holidays and
calendar.
3 for exec.
Okay.
It's just the way the calendar falls in 2022, so, Member Chung.
I was trying to remember what I was going to ask. Yes, so are we talking about moving just those dates that are in conflict or permanently just changing it for the?
I would suggest totally changing it, just because it gives continuity to everything.
Okay, thank you.
Instead of, oh, this month we're going to meet at Monday afternoon, next month we're going to meet, Thursday morning, oh, and then we're going to meet Thursday morning, oh, then, back and forth. I think that for us and for the public, it's probably better to have a set date and time. Member Johnston,
And when you say in the morning, are we talking about 8 a.m.,
7:30.
7:30?
Staff
Yeah,
could go as
and
early
this-
as 7.
Huh?
Staff could go as early as 7. We arrive at 7, we could go as early as 7 a.m.
Yeah, we could, 7. I think that might be a little early for us retired people, but, and I know Member Chung might have some challenges with that sometimes too. So that's why I said, I'd like you to think about it to see how you want to approach this. And like I said, there's not a lot of options since we are sharing this room. And I guess we can discuss it again in either November, because December, we'll definitely want to know what we're going to be doing moving forward for 2022. So we can discuss this again, but just kind of look at what you could maybe adjust in your schedules and calendars and what would work and stuff like that, so. Okay.
I have a
And-
suggestion, if I may.
Mhm.
Would it be helpful to the committee if Ms. Morlock put out a doodle poll of available times?
That'd be fine.
Very good, we'll see that happens.
Okay, and one other item I have is the forum begins tomorrow. And we have one session at 10 and one at noon, which yours truly will be part of. So if you haven't registered for that, please do. Some of you probably already got emails to register a week or 2 ago, so. But yeah, we're going to have it much more condensed this year and be done in 6 weeks. Because we have 2 sessions tomorrow and then one on Thursday, which I'm also part of, fortunately. So anybody else have any other business or communication? Nope. Okay. We have bills to pay, and the auditor has approved them, and they comply with all of our ordinances, resolutions, and policies. First is jail and JDC Medical, 43, with a prepaid total of $43,806.51. Motion by Chung, second by Martin. All in favor? Any opposed? Okay, that passed. Developmental Disabilities Board has a prepaid total of $119,986.47. Motion by Johnston, second by Metzger. All in favor? That passed. Nursing home has a prepaid total of $214,246.52. Motion by Chung, second by Beer. All in favor? Any opposed? Motion passes. And the Board of Health has a prepaid total of $294,590.19. Motion by Metzger, second by Johnston. All in favor? Any opposed? And that passes. And that, I believe, we are adjourned. Thank you.